Good evening, and thank you to Megamind for providing this incredible platform to showcase our dental implant cases and surgical approach. It's an honor to have the opportunity to present to an international stage and share our expertise with fellow dental professionals. Today, I will discuss some of the most challenging cases and how our surgical approach has led to successful outcomes. Thank you for joining me, and let's begin. As dentists, we always look for ways to improve our patients' experiences and outcomes. But have we been too stuck in our ways? Is it time to question conventional treatment and consider new techniques that can offer better results with less trauma to the patient? My name is Kua, Dr. Kuajit Singh Chani, and I'm a proud resident of the historical city of Nottingham, England, United Kingdom. Nottingham is known for its rich history and culture, with landmarks like the famous Robin Hood statue, the majestic Nottingham Castle and Woollerton Hall, which served as the backdrop for the Batman film. As a dental implant specialist in this vibrant city, I am passionate about helping patients achieve healthy, beautiful smile that they can be proud of. I received my dental education at the prestigious Birmingham University Dental Hospital, where I honed my skills in dentistry under the guidance of some of the leading experts in the field. Since then, I have dedicated myself to staying at the forefront of the latest advances in implant technology and surgical techniques. My passion for implant dentistry was sparked during my time at university, where I was introduced to this remarkable field. It was there that I realized that dental implants offer a life-changing solution for patients who had lost their teeth, and I was determined to become a part of their transformative process. During my fourth year, a visiting clinician gave a lecture on his experience with dental implants, and I vividly remember turning to my friend and colleague and saying, one day, that's what I want to do. That's the dentistry I want to provide my patients. Over the past 10 years, I have dedicated myself to mastering the art and science of implant dentistry, and it has been a beautiful journey, full of challenges and rewards. As I look forward to the next 10 years, I am excited to continue providing my patients with exceptional care and innovative solutions with passion and kindness. This is a picture of me and my wonderful team who have been instrumental in providing the exceptional dental care that we offer our patients. I want to take this opportunity to thank my amazing team. I truly could not have achieved any of this without their unwavering support, dedication, and expertise. Their hard work and commitment to providing exceptional dental care has allowed us to make real differences in the lives of our patients. Thank you from the bottom of my heart. As dentists, we know that everything we do must be based on scientific proof and evidence. This is why I am excited to share with you a finding from a recent study in the International Journal of Periodontics and Restorative Dentistry, which concluded that partial extraction therapy is a highly promising technique for managing a failing dentition over the long term. I believe that this innovation, along with other groundbreaking research, allows us to take baby steps in the footprints of giants and provide better care for our patients. It is an honor to be part of this community, and I am grateful for the opportunity to share my experiences with you all. Let me introduce you to our patient, a 36-year-old male with a failing dentition, decay, caries, and over-eruption of the lower anterior teeth. He came to us with a goal to smile and eat pain-free. Medically, he is fit and well. He's a non-smoker. I assessed his case and provide a personalized treatment plan to restore his smile and oral health. The visual record of these patients' starting condition is critical for the planning and execution of their treatment. These pictures provide us with a reference point to understand where the patient was and where they are heading. With these images, we can formulate a treatment plan that addresses the patient's concerns and desires while taking into account their unique circumstances. It allows us to track the progress and make necessary adjustments to achieve the best possible outcome. This cone beam CT scan is a valuable tool in our pre-surgical planning process. I have taken a 3D image of the patient's jaw. We can assess the quality and quantity of the bone. identify any abnormalities or pathologies, and evaluate the proximity to critical structures such as nerves and sinuses. This information allows us to create a customized treatment plan for each patient, maximizing their chances for success, maximizing their chances for a successful outcome. The use of digital planning software also allows to minimize surgical time and potential complications, ultimately improving the patient's overall experience. This 3D printed wax-up of the patient's mouth, which I have designed using a third-party software called Mesh Mixer. This model will help us to create a temporary restoration for the patient after surgery. Additionally, I have fabricated a pressure foam splint which will assist in the manufacturing of the temporary restoration. By starting with the end in mind and utilizing advanced technology, we can ensure that the patient receives the best and the highest quality care possible. I'm very grateful for Megagen for their partial extraction therapy kit and their working protocol. They have very eloquently broken down each step of what is required and how to conduct this to achieve the most successful outcome. This is the Megagen partial extraction therapy kit, which has been instrumental in achieving successful outcomes for our patients. I am extremely grateful to Megagen for their well-designed kit and working protocol, which has simplified the process and made it easy to use. The workflow is presented in a clear and concise manner, with each step laid out in the order that need to be used. There is even a helpful diagram at the base of the guide, just in case we need it. I'd like to extend my thanks to Howard Gluckman and the team at Megagen for their contribution to this fabulous kit. Let's dive into the surgery. To ensure a clear operating field, we have placed an operagate retractor around the lips. This eliminates the need for uncomfortable tissue retractions or lip pulling. We prioritize the patient's comfort at all times. As you can see from the image, we have started the process of making gross reductions to the teeth prior to beginning the partial extraction therapy. This helps prepare the site for the next stage and ensures a smoother procedure. We have started the partial extraction therapy procedure by taking out the number 2 drill and dividing the root. Our goal is to preserve the buccal portion of the root, which is crucial for supporting the bundle bone and maintaining the correct soft tissue and bone volume over time. This slide shows that a fine luxator is being used to apply pressure to the palatal aspect of the root, while carefully removing the portion that needs to be extracted, without putting any pressure on the buccal aspect of the root. On this slide, you can see that we continue to use the same technique on the other teeth, carefully preserving the tissue and roots that we want to keep. By dividing and removing only the targeted portion of the roots, we ensure that the surrounding bone and gum are preserved, which is critical for long-term success. And as you can see, the process is repeated on each tooth until we have removed the desired amount of tooth structure. I use my thumb to support the buccal root, which helps to prevent any unnecessary pressure on this area. This technique ensures that we are only removing the portion of the tooth that we want. We have made good progress in the partial extraction therapy process. However, to ensure there is no underlying pathology and to check the integrity of the buccal bone, we have chosen to raise the flap. This also gives us the opportunity to augment the area with a graft after the placement of the implants. It is important that the implants are placed in a manner where the threads of the implants are not in contact with the root surface. This is to ensure there is a gap for a clot to form and eventually bone to infill to allow the best integration possible for our implants. You can also see at this stage I've placed my temporary cylinders, and my technique is to place composite around the neck of those temporary cylinders to ensure smooth tissue healing. While implants may not have superpowers, they certainly have the ability to transform lives and restore function and aesthetics for patients. As you can see from this slide, implant packaging can be quite fun and unique. Implants are like the unsung heroes of restorative dentistry, providing a strong foundation of restorations and helping to improve the quality of life for many patients. My own personal research has allowed me to discover 1 in 35 implants Megagen provide are yellow. So yellow is literally the gold that we are digging for when we're placing implants. As you can see, I have 10 gold bars and I hope to grow my collection. But all jokes aside, the Megagen AnyRidge system is an amazing system and allows me to do things other implant systems have fallen short on. The guide drills allow for an effortless workflow. May it be fully guided or semi-guided, this system allows you to create osteotomies you desire. A lot of my workflow involves temporary restorations for patients, which helps me manage the aesthetic outcome and make adjustments that I need prior to manufacturing the final restorations. I will dread removing temporary restorations on previous systems, but with the Megagen, a button remover driver makes removing temporary restorations effortless and stress-free. And what makes dentistry more fun? Less stress. Often I explain to my patients that having implant dentistry is very much like hanging a TV on the wall. Everybody wants a TV that is hung level, a TV that looks good and works. People aren't often interested in the screws or the raw plugs. That is until the TV fails. So always hang a TV using the best screws and fixation that you can, and that's why I choose Megagen, and I want that smile to stay. So we have placed the temporary implant cylinders and sutured the site with resorbable sutures. We're using a rubber dam to protect the surgical site during the fabrication of the acrylic bridge. Post-operative x-rays show that 3 implants are in position. Each was inserted with an insertion torque greater than 30 Newton centimeters, giving us the peace of mind that these implants can be loaded predictably. Moving on to the 2-month review, this slide shows the temporary bridge in place, and it is evident that we have achieved good aesthetics and function. The patient has done a great job in maintaining the oral health despite the challenges that come with a temporary bridge. For the final bridge, all screw access holes are nicely positioned plately. It was essential that the bridge to be made in a manner which is screw retained, so that if any complications in the future occur with the partial extraction therapy approach, we can easily manage those complications without damaging the bridge. I'm pleased to say that we're now scanning all restorative cases with the Megagen scan bodies. And I find that we're getting better results, less retries, and providing more comfort to our patients as impressions and molds are no longer needed. The bridge sits beautifully, the tissue profile looks amazing, post-operative x-rays show good bone formation around these implants, and I am confident that they will continue to remodel and the bone health will continue to improve as the bridge is in occlusal function. The side profile picture shows we have managed to maintain architecture that you would only see with roots in position. My hope is that this architecture will hold for the long term, ensuring good tissue and bone volume for our patients. And if implant therapy is needed again in the future, he is in a good position to allow additional implants to be placed. However, if we can keep good oral hygiene, make sure that the occlusal load on the implants are not overexerted, this patient should see his implants go on and on and on and on. So it's critical to reflect on how far we've come. None of this would have been possible without the meticulous planning and precision implant placement made possible without the aid of digital technology. By using advanced digital tools, we're able to achieve a more predictable and accurate surgical approach, which is essential for ensuring a successful outcome for our patients. As I reflect on this journey, I'm reminded of the passion for dentistry that was sparked for me in that 4th-year dental student. Through the precision and advancements in technology, we are able to execute our treatment plans with greater accuracy and achieve exceptional results for our patients. This passion in precision has been the driving force behind my work, and I am grateful for the opportunity it has afforded me in delivering high quality care. And to finish, these words are ones I try to embody in my everyday dentistry. Let no one ever come to you without leaving better and happier. Be the living expression of God's kindness, kindness in your face, kindness in your eyes, and kindness in your smile. As we conclude, let us remember that our ultimate goal is not just to create beautiful smiles, but to spread kindness and joy in the world. Let us strive to be the embodiment of Mother Teresa's words and make a positive impact on the lives of those we encounter. Together, with our passion for precision and dedication to kindness, we can make a difference in the world, one smile at a time.